Welcome to Health eConnect Alaska's training on Population Explorer, the HIE portal tool that lets you see near real-time patient encounters and manage follow-up care, outreach, and care coordination strategies. In this video, we'll cover the purpose and benefits of Population Explorer, how to access and configure it, how to navigate it confidently, how to use filters to manage follow-up work, how to manage follow-up using downloads or the built-in tracking features. Please use our resource library for information on related topics such as an introduction to the Health Information Exchange portal, the My Patient Summary tool, patient panels. Population Explorer is an incredibly powerful tool that helps you coordinate care in real time for patients with complex care needs and transitions of care, particularly from hospitals and emergency rooms. The tool provides encounter notifications for patients in your panel, including visits, admissions, discharges, or transfers across HIE participating facilities, and provides detailed information about each patient encounter. Population Explorer consolidates related events, giving a complete picture of each patient encounter. The tool also includes status tracking features that help your team manage follow-up tasks directly within the application. Population Explorer is accessed directly from within the HIE portal. By default, it appears as a sidebar widget on the right. Click the bar to open or hide it. To begin viewing notifications, select your patient panel from the drop-down box. Most users have only one panel. If you're in a larger organization, you may have multiple options. Use the gear icon to access settings. We recommend saving your default panel to avoid having to manually select your panel each time. From this menu, you can also define preferences such as default widget view, download options, and whether certain features such as follow-up status management or advanced filtering are displayed. We'll reference and elaborate on these settings more as we explore the tool further. From the sidebar, you can scroll through a list of encounter notifications. Click any encounter to open its details in full screen. You can also click the sidebar to expand the widget to full screen and access all Population Explorer features. Remember, your default Population Explorer window size can be set in Settings. Population Explorer has two main views: Encounter Detail View, which is focused on individual encounters, and Table View, which provides an at-a-glance list across multiple encounters. Each supports different follow-up workflows. In the main Encounter Details view, the left side displays a chronological list of encounters with the most recent displayed at the top. The right side displays detailed information about the selected encounter, such as patient demographics, details specific to the selected encounter, encounter history, aggregated visit data across the past 30, 60, 90, and 180 days, encounter types such as inpatient, outpatient, or emergency visits. Sections within encounter details can be collapsed or expanded individually using the plus or minus icons next to each section header. You can also use the plus and minus icons at the top of the screen to expand or collapse all sections at once. Users can navigate directly into the patient's chart to review additional clinical context prior to conducting the follow-up. Right-click on the notification and click the Clinical Information application. This opens the patient's standard HIE clinical information chart without the need to return to the home screen to search by name and date of birth. Please note that opening the patient chart will navigate away from Population Explorer. Filters help you narrow the encounter list based on specific criteria, helping prioritize follow-up work or focus on specific patient populations or clinical scenarios, such as primary care facilities keeping track of their patients' recent hospitalizations or ER visits to prioritize follow-ups. Discharge planners coordinating with primary care and specialists for transition of care. Identifying high-risk or high utilizers for outreach and supportive care coordination. Evaluate social care needs diagnosed at other healthcare facilities to perform targeted outreach and offer care coordination, referrals, or support. To apply filters, select a filter type such as encounter type, date change, diagnosis, or facility name, and enter your filter criteria. Filters can be layered using multiple criteria. Results update immediately in your encounter list in both the detail and table views. To save a frequently used filter, click Save Filter, name it, and click Save. Saved filters can be applied in future sessions without rebuilding criteria. To find and apply a previously saved filter, select it from the Saved Filters, then click Load. Your list of saved filters can be edited and updated at any time. This is especially useful if you navigate away to view patient charts. Saved filters prevent the need to redo complex selections every time you return to Population Explorer. To return to the full encounter list, select Clear Filters at any time. For facilities that wish to use their own internal systems to track follow-up activities, the download feature can be especially helpful. You can download your full encounter notification list from the widget view or full screen view. Click the Export button to download encounter data as a spreadsheet. In the pop-up window, you must acknowledge that you are authorized to access protected health information, which is subject to HIPAA. Select which fields to include. You can also download individual patient encounter details as a PDF or Excel file by choosing the Patient Export option within the Patient's Encounter Detail section. For facilities that want to use the built-in status management feature in Population Explorer, you can access and update the status field in both the encounter detail and table views. Status options include Not Started, In Progress, Complete, No Planned Follow-up. The selected status is only visible within your organization. Status field options are intended to be defined by your facility to best meet your team's needs. A history of status changes is maintained at the bottom of the encounter detail view, showing who last updated each encounter's status so your team can track progress and stay aligned on the follow-up efforts. Remember, you can enable or disable the status management feature in your user settings. Lastly, the table view provides an at-a-glance list of encounter data across your full panel or a filtered list. It displays key encounter fields and follow-up status in columns, allowing you to scan trends and manage follow-up activity across multiple patients. Columns can be customized to show the information most relevant to your workflow. You can sort the table by any column. And you can update status directly from within the table view. This view is particularly effective for care management, giving your team a clear, centralized view of patient encounters and follow-up status so actions can be tracked and coordinated across users. You've now learned the purpose and benefits of Population Explorer, how to access, configure, and navigate it, and how to use filters and manage follow-up activity using downloaded records or the built-in tracking feature. We hope you leverage this tool to create custom filters specific to your organization's workflow needs and to ensure you are receiving updates on the care your patients are receiving. from chronic care management to emergency room visits. Please contact your Healthy Connect Alaska account manager for additional assistance or to set up advanced filters. For more resources or questions, visit healthyconnectak.org or email info@healtheconnectak.org.